Hello, aspiring surgeons, and welcome back to our channel. I am Dr. Strange, and today we are diving right back into the world of surgical skills. In our last video, we explored the fundamentals of suturings, what is the basic setup, and today we are taking it up a notch higher with advanced suturing techniques. So let's start with the basically how to tie the knot with the help of instruments. So simple interrupted suture, this is the cornerstone of suturing, or most of the sutures will be simple interrupted. So I am using the palm grip. Notice and practice how to hold the basically needle holder. This is short needle holder. So while you are suturing on the surface, then short needle holders are good. Otherwise, for depth, long needle. So long needle holders are required for depth. So we hit the this skin to be basically pass the needle at 90 degrees. So look how my this hand is fully prone, and I am not pushing anywhere. I am just following the curve of needle. So you have to practice these techniques, friends. Watch your thoughts and action very carefully during the beginning. So whatever you do over time becomes a habit, and these habits over time will define you as a surgeon. So I mean, you have to monitor your habits and thought very carefully, so that they becomes your action into habits and habits into character. So I have taken the first bite. So again, roughly 1 to 1.5 centimeter from the margin, and you have to stay in the same on this horizontal plane. Don't create different basically entry and exit point. Stay in the same plane on both sides, and entry and exit point should be in the same plane. So again, if you notice, then I'm not touching the needle with the help of hands, and all these needle transfers are with the help of instruments only. So you have to practice these maneuvers, and please apply at least 100 to 200 stitches with the help the same way I have demonstrated, so that you master. And please share that pic in the comment section on our app or in the chat section, so that you stay tuned to our this suturing technique. I hope you already bought the instruments which I have mentioned. So this is a perfect this knot tying. So I have taken 2 throws, and this smaller end has to rotate every time by 180 degree. So I have taken another throw, single throw. First throw was double, and again the shorter end is going to the opposite side by 180 degree. Hands has to cross. That gives you better knotting properties. So this is how we will apply the knots. So keep your canvas ready, find some suitable corner in your room or in your house, and start practicing the suturing technique. Again, I am repeating here that follow the curve of needle, and how to hold the needle I have already discussed. It can be 2/3, 1/3, anterior 2/3 and posterior 1/3 junction, or half, whatever you prefer. So the entry exit point are at the same level, same horizontal plane. And again, if you want a bigger basically circumference of the tissue, then you hold 2/3, 1/3. Otherwise, half circumference is okay. So come inside the V. This is a V with a longer limb and shorter limb. I took 2 throws. My hands will rotate, and this is a perfect surgical knot. Again, come inside the V, and then apply another throw, so that will create a perfect knotting for you guys. As we progress, we will be sharing these tricks of trade. So sometime you will notice that the basically the knots should not be on the cut edge, or basically the opposed surface. The knot should be away from the cut edge. So you can simply slide these knots to one end, and this knot will be away from the cut margin. So it gives basically a lesser discomfort to the patient, lesser pain, and lesser basically suture mark. So you have to slide the knot to one edge. The trick of trade for you guys will be, sometimes the tissues are under tension, and you are not able to basically, while you are applying the knot will automatically get loosened. So how to avoid that thing? So like how to lock the knot. So I came inside the V, taken two throws, and if it's not holding, so it is basically here we are using Prolene. You can see how easily it is slipping and the margin will slip. So how to handle this technique is like how that keep the longer end under tension and rotate the smaller end to one side, and it will automatically get locked. So you have to practice this technique, how to lock, because every time you should not tell some of your basically assistant to hold the knot for you. That won't look aesthetic. So practice this technique of locking this thing. And again, if you are still facing difficulty of holding the tissue edges again through the first bite, then the another technique for you guys will be you take three throws. Basically initially we take two throws, but you can take three throws and that will hold beautifully. We are using here Prolene, but the silk will hold beautifully. In the next part of this video, we'll talk about the vertical mattress sutures. So friends, vertical mattress sutures offers exceptional wound edge eversion and tension distribution. It is one of the suture that you will be using most of your suturing techniques. So one should master this technique. So again, initially it is also called far near suture. So again, as I said, it creates best tissue apposition. So again, we go through the another edge. Don't take the two bites at same time. These small tricks, small tips I'm sharing, please do remember, watch these videos time and again, friends, so that you learn the things in a right way, you practice them in a right way, and you become a good surgeon. So when we are taking the near suture, the trick of the trade here will be, don't take more than 2-3 mm of the edge. Just take epidermis, dermis, just 2 mm or 3 mm, not more than 3. 2 mm lesser is better. So that will give you better tissue eversion and best apposition of the tissue. More tissue you take, and lesser is the basically apposition, and it will compromise the cosmesis also. So I have taken lesser tissue. So if I take even lesser, then it will give a better cosmetic result, and even the tissue distribution, the tension distribution will be same. So another trick of the trade for you guys will be, look here that I'm demonstrating here for the sake of demonstration, that if I take too much tissue in the near bite, then it creates a sort of strangulation effect. So just remember, don't take more than 2-3 mm in the maximum 2 mm in the near bite. So for the sake of demonstration, just if I taking too much tissue, and I am just going against the lay down principle, that I pass the needle through both the edges in the same time, and again I am not in the same vertical or horizontal plane is different. So this will create a sort of strangulation, and it is undesirable. The whole aim of the vertical mattress suture is then defeated. So friends, another trick of trade I'll share with you guys. So there will be some situation where one edge of the wound is below the another edge, like especially there's a tissue loss, or you have excised some tissue, or there is trauma. Like here we have created that effect with the help of this pin. So how to then oppose these edges? So simply we start in a similar manner, that we take this simple interrupter suture, this far suturing. So the edge which is lower down, or on the edge where there is a tissue loss, we take a larger bite or more chunk of tissue, more depth and more tissue. Similarly, when coming back, while taking the near suture, I'll be taking more tissue on the side which is down, and lesser tissue on the side which is higher. So we are trying to compensate the tissue loss by taking more tissue, and it will give you a better position. Again, remember that all the entry and exit port for near suture has to be in the same horizontal plane. So remember this technique in your armamentarium, and then you will have a better cosmetic outcome. So as demonstrated here, the tissue will oppose better. So the next addition to your armamentarium will be horizontal mattress suture. So it provides excellent wound edge eversion, reducing the risk of unsightly scarring as your sutures are away from the wound margin, and improving cosmesis. It also distributes the tension along the wound, preventing excessive strain on any single point. Friends, as far as I am concerned, practically I have used the vertical mattress suture, the horizontal mattress suture only in cases where we wanted to achieve a basically hemostatic effect. So it gives a very good hemostatic effect, but if you check the literature, then it is also a cosmetic suture and faster way of closing as compared to the vertical mattress suture. But practically I feel that you may have a different experience in your institution, that it is a lesser use suture, and it will be used lesser only in case where you want to oppose the hemostatic effect. So we start simply with this far suture in the vertical mattress suture or the simple interrupter suture. Then similar margin at the distance from the wound margin, I'll progress along the wound margin. The distance I approximately same. So I take another. So I have progressed horizontally and have taken a similar suture ahead, and similarly, so horizontally I have basically progressed on the wound, and now I am opposing. So this is how. So the suture is away from the wound margin, and it is said to be cosmetically better, and practically, as I said, we use it for the hemostatic effect. So the next part we will talk about the simple buried suture. So simple buried suture, again, surgeon, you will be opposing the subcutaneous tissue, and especially in case you have placed the mesh like onlay mesh where, then we want to have another layer beneath the skin, so that if there is any discontinuity in the skin, then the mesh is not exposed to the environment. Or other benefit will be like suture placed beneath the skin surface, so you can close the whole skin surface like a simple buried suture, and there is no need to apply the suture above the skin. So there is no visible suture, and above that you can simply close with the help of glue. Or advanced technique used in surgical procedure to achieve precise wound closure by minimizing the visibility of suture on the skin surface. So it is another technique must to have in the armamentarium of all the surgery trainees. So we start from the opposite side. In all the suturing technique, I started on the same side from I started from the right side, then here I started from the opposite side, so that my end is down. Then I come to the other side, so both the ends, needle ends, are basically looking downwards toward the, and here we take through the dermis, epidermis, junction, and subcutaneous tissue, and then this both the ends are coming down now. So do practice this technique also. The basically knot is buried, knot is not visible, buried inside the tissue, and the subcutaneous tissue is perfectly opposed. So every stitch you make brings you one step closer to the mastery. Embrace the challenge, embrace the journey, and become the skilled surgeon you aspire to be. So thanks for watching. Happy learning.